Bismillahirrahmanirrahim. My name is Dr. Abdullah Hussain. Currently, I'm working as a junior grade doctor in one of the tertiary care hospitals of Lahore, Pakistan. Today, I'm going to present my poster, which is on a very important topic, mentioning antibiotic resistance pattern. As we all know, it is one of the significant and crucial topic which need most of the attention of the treating physicians and pharmacists. The title of my poster is A Clinical Audit to Evaluate Antibiotic Prescribing Practice in Pediatric Patients Admitted for Enteric Fever, Rationalizing Antibiotic Stewardship Program. Here is my poster. You can all see that it includes introduction, results, conclusions, and some results in form of bar diagrams. Okay, I will explain different headings separately. Okay. An exponential rise in antibiotic resistance in Salmonella typhi is an emerging threat globally due to unnecessary misuse of antibiotics leading to a terrific multi-drug resistant strains, making them inept. Multi-drug resistant strains are prevailing worldwide. It is the need of the hour that medical staff should be able to escalate or de-escalate the use of antibiotics therapy according to the antibiotic sensitivity testing report. This can only be done by developing antibiotic stewardship program at local hospitals level. Okay, these are the subjects and method of my study. A prospective audit was completed in the pediatric wards of Tertiary Care Hospital of Lahore over the period of 1 year. Blood cultures reports were collected from microbiology department and the clinical data were assessed regarding the choice of antibiotics, their frequency, dosage, and clinical outcome. All the statistics were analyzed using SPSS software and compared with the guidelines. Here come the results. Out of 157 cases hospitalized with the suspicion of enteric fever, 137 cultures were positive for Salmonella. Monotherapy of ceftriaxone was prescribed mostly as empirical therapy, and the percentage includes 70%. About 20% of patients received a combination of antibiotics empirically. Susceptibility reports showed only 7 cases were of non-resistant typhoid, while 15 multi-drug resistant and 115 extensively drug resistant. Nearly 46% of patients were discharged earlier, whose empirical therapy was changed either before or promptly after susceptibility reporting. Commonly used definitive antibiotics were combination of azithromycin and meropenem. Okay, here the bar diagram which shows the very important and significant information regarding drug susceptibility pattern. As we all can see that the drugs like ciprofloxacin, third generation cephalosporins like ceftriaxone, and drugs like chloramphenicol and chlorotimoxazole are becoming resistant to number of Salmonella typhi strains, while the only drugs which remain sensitive and susceptible to the Salmonella typhi were azithromycin, imipenem, and meropenem. Okay, the conclusion of my study. Inappropriate use of antibiotics was noted frequently as compared to the guidelines. However, recommendations themselves need to be reviewed as antibiotic resistant patterns are changing drastically. These are the references which are included in my study. These are WHO international guidelines published in 2015 about typhoid fever treatment and national guidelines by National Infection Drug Control Center. These guidelines were published in 2019. Here's my poster again. You can all see that. In case of any query, you can always contact me. Thank you so much.